Hello, my future librarians. So you are looking at the different fields of librarianship, and you are looking at the health sciences um, librarian role. So let's go in a little bit into that. So part of that role could be helping to do research for, a doctor, a nurse, a patient, just to try to figure out what their medical condition is and what's the best way to help it. Now, obviously, when it comes to the medical field, there's so much out there. People react to medicines in different ways. You know, there's so much to consider. So doing that research can be a little bit overwhelming at times. Because oh, you're looking at this one thing, but you also have to consider this condition the patient has. So, in order to help kind of focus the research questions so you remember to have all those research terms in there that you may need, we have Pico, which is just a way to kind of help frame these research questions so you have the most relevant things in your search so you don't forget something, because that can affect your patient. So let's go to page number 2. So Pico, it's just letters put together to kind of help you remember what you really need in those search terms. So P, it's for the patient, the population, the problem. So if you have a specific patient, you may want to type in specifically, oh, I have an elderly person, or maybe you're looking at the elderly population as a whole, or maybe you're looking at the problem. It's the intervention, it's the exposure. It's like, what are you using to help them? What are you trying to make sure will work for them? The C, it's a comparison, it's a control. So you may be just looking at the person themselves, like, hey, if I do this, will it make their condition better than if I don't do it? And then O is the outcome. It's kind of there to kind of help you figure out, okay, if I tell them to do X or use this, will it make a difference compared to if they don't use that? So just remembering Pico can kind of help you make sure you have the search terms. All right. I do apologize. I have a little bit of cough, which will come up in example number 2. So let's look at example number 1. You have a patient, they have heart problems, they smoke. Will getting the patient to quit smoking help reduce the heart problem? Will it make a difference? So P, okay, your population, your patient is, somebody who smokes with a heart problem. The intervention is, hey, you need to quit smoking. The control group is, it's either other patients with the same problem who they're refusing to quit smoking. They're like, nope, it's not going to make a difference. Or maybe even you're looking at the patient themselves, like, well, this is how you were for these 2 weeks, after you were diagnosed with a heart problem and smoking. Now let's compare that to, after you quit smoking. Like, was there a difference? Or again, you may have the control group, and obviously you can't tell people, hey, you're my control group, you can't quit smoking, but maybe you have people who are just refusing to. Again, not really so much our problem. That's, more like if you were to do a research, or, if you were a medical doctor, that would come up a little bit more. If you're just looking at research that's already been done, you're just putting in, patients who didn't quit smoking. And then the outcome would be, did it make a difference with their heart problem? So yeah. And then example 2, and this is where I'm putting myself into this. I've had this cough for the past 3.5, 4 weeks. Won't go away. So you have a patient, can't stop coughing after having a viral infection. Will certain cough medication help? Now, obviously, when you do this, you're going to have a specific cough medication in mind. I've just tried so many over the past 3 weeks, I cannot pick one. Although I will say Vicks Vapor Rub seems to be the only thing that helps me to settle my coughing. I don't know why. Actual prescription medication, I'm still coughing. So anyways, your patient is the patient with the cough. That's me. The intervention is the cough medication. And again, maybe you're comparing it to when I used a different cough medication, or maybe you're comparing me to patients who didn't use cough medications. But oh, the outcome, you're kind of looking at, hey, did this specific cough medication make a difference in my coughing, either compared to somebody else who's coughing who didn't use it, or even maybe to myself 2 weeks earlier? Like, all of a sudden you find that miracle one that I take, and I'm like, wow, my coughing has stopped. Thank you so much. Um, so yeah, that's kind of how Pico works. Again, like it's something that as you use it more, you'll get practice. Um, Here is my source. It's actually a YouTube video, but it is very helpful and it pretty much tells you what I just told you. They just use different examples though. So hopefully this kind of helps you. So as you kind of look more at health librarianship as a career, you can kind of practice using this and see if it's something that catches on easily, that you're like, yeah, I like this field and I want to go into it. So thank you so much for listening to me. And if you do have a medicine recommendation, please let me know. Thank you. Have a good day.